All right, everybody, welcome to another podcast. I'm Marcia Hawkins. I'm speaking with Stephanie Nascimento of Be Vital Wellness in Hadley, Massachusetts. Today, we're going to be talking about peptide therapies, which is a buzzword right now. Welcome aboard, Stephanie.
Thank you, Marcia. Thank you for having me.
Absolutely. You're one of my favorite people. I love talking to you. You have so much knowledge, and knowledge is wealth, in my opinion. And this is a peptide. Peptides are a buzzword. Let's face it. They are everywhere. I cannot log onto social media without being inundated with all sorts of advertisements for peptides. So let's delve right into it. Can you
Yes.
explain to everybody specifically what peptides can do for them in just a quick snippet of that, and then we'll dive into individual therapies.
Okay, sure. Yes, peptides are quite the buzz right now, and I couldn't agree more. They are everywhere. Every social media app I open, that is, and I know it has a lot to do with my feed because that is what I'm looking at, but it is everywhere. And there's good reason for that. With our wellness and health, we are definitely changing in medicine, and we are going more towards health and wellness than we are using medicine the way that it had been previously used, which I think is a wonderful, beautiful thing. Peptides themselves are a string of amino acids. It's not big enough to be a protein, so we call them a peptide. So our body knows how to use them appropriately to help with processes in the body, like cellular processes, very similar to minerals and vitamins. Okay. It is a little different. It is a synthetic peptide that's made. That's what is being used now in these longevity and wellness programs. But so many of them are being currently studied with great evidence informed information coming out, which is really exciting.
So, what type of things can you address with your wellness journey that peptides can assist people with?
That's a great question. Peptides have been used for a long time already. I mean, it's newly a buzzword, but they have been used in med spas and anti-aging longevity spaces for much longer. So they're not new. This is not new information, but now it's become more popular in wellness spaces and health coaching and that kind of thing. So anything that you can imagine that you might be starting to lose as you age, this helps replenish. So that's why it's very much associated with anti-aging. I can give you an example. So copper peptide, for example, is very helpful in encouraging elasticity in skin and hair growth and nail growth. So obviously that's something we start to lose, right? We lose that elastin in our body starting, unfortunately, I'm not even going to tell you what age you start to lose that. It's much too early. And those exactly. And some of these are connected to hormonal decreases as well, right? So we know after 35 for some, after 40 for others, after 45 for other human beings, they start to drop their hormone levels. And with that, we're not making the same peptides that we need to replenish those cells and turn those cells over. That's one of the ways.
You just opened my mind. I feel if you just take a visual of me with my hands pulling my brain open, and all of a sudden, all this information just came into my head. So I have to go down this road right now, though, because something you said, you're like, these have been around for a long time and we've used them. So it begs the question, why are they not incorporating these as like preventative medicine? It doesn't make any sense to me.
It doesn't. Unfortunately, there isn't a lot of money to be made, for lack of a better explanation. There isn't a lot of money to be made in selling peptides in the medical space.
So you can
So
make a lot more money when people feel crummy.
yes,
Okay.
unfortunately, that is the sad truth. And we're hearing about that a lot now in the media, profiting off of sick care instead of preventative care or health care for that matter. I think the first time we spoke on a podcast together, I explained that my business partner and I left our previous jobs because we were tired of working in sick care. And I left the hospital because that's what it felt like to me,
Mhm.
is just putting these band-aids on folks with medications and with IV drips and things like that that were medicine. But at that point, they've gone to a place of disease. And there's so many ways to prevent that from happening in the first place. So my business partner, Jeanette Wilburn, and I had stepped out of that sick care. And our mission was to really energize and empower people in healthcare and preventative care. And so that's why we love peptides, because that is exactly what peptides can do, just like good nutrition can do.
So, as a patient, the patient has to step outside of sick care and decide they want to go the route of well care.
Absolutely. Absolutely. But one of the issues that arises in that is that there isn't a lot of research being done on specific peptides. It's starting, it's about to change, which I'm very happy to say. Previously, there hadn't been a lot. So it was almost kind of in this dark area of hush hush. People would be able to order some of them online. You could find some naturopathic doctors and functional medicine doctors utilizing them in pill form, which is wonderful. And so they were definitely ahead of this curve. But now it is being brought in. It's doctor MDs are doing the research on it, and they are encouraging this to open up a bit. And I am thrilled to hear that as a nurse.
Absolutely. I did a podcast right around pandemic time. I had Dr. Let's see, he's out of Florida. I had him on my show, I want to say 6 or 7 times.
Oh, nice.
And we would laugh because he's like, "Oh my gosh, like I wish all my patients thought like you did." Because I've always subscribed to get preventative. I've done numerous podcasts about this that not only relate to physical health, but financial health and relationship health and all sorts of things, that it's so much easier to do things preventatively and therapeutically than to try to swallow an elephant when you've got a major problem on your hands with your, whether it's your health or your finances or whatever. But
Right.
as it pertains to the peptide therapy, I just have to believe, Stephanie, that part of the problem is we are just conditioned that if we have a problem, my big joke is, and if I explained this to you before, you stop me. But
Mm.
when my kids were little and they had an earache, I would go to CVS to get the amoxicillin. And there was one pharmacist there with a little basket with maybe 5 prescriptions in it. And that was it. Now
Right.
now walk into CVS. And when you walk in there, there's a drive up. There's like 4 pharmacists. There's like 7 techs. There's 3 lanes. There's apps. You can get your blood pressure
Right.
taken. There's a waiting room. They've even got Minute Clinic in some of them. And I would say, I think I read, because when I did my research for one of my podcasts, I think I researched that most adults over age 60 are on 7 to 8 medications. And yeah,
Polypharmacy is what we would call it in the hospital.
yeah,
Yeah,
it's just,
polypharmacy is awful.
yeah, the first thing they ask you when you go anywhere, what are your what are you taking for medications? And they always laugh when I tell them I don't take anything. I don't take any medication, and I'm up there. So it's really it's quite amazing to me. But have we gotten that sick, or have we come up with so many medications? And don't even get me started on the side effects and the spillover of that, because once you take one medication, side effect, and then you get another symptom. So it appears to me, and this is what I dove into with this doctor on, I think we did a half a dozen, if not a dozen podcasts. And he was saying that, yes, it's like we've got a pill for everything. And I always say, you can go to the doctors now. You're either going to walk out with a happy pill, a pain pill, or a why me pill. And rather than really looking at the root cause, or in your case, being able to set people up with therapeutic peptides to really get people feeling better, so they'd have more energy to go for a 20-minute walk every day and keep their blood pressure under control. And maybe they're not eating so much food because they're bored and they're feeling better. The list goes on and on with the benefits of good health. But yeah, it does seem like we're more diving into the prescription drugs, and they definitely serve their purpose. There is absolutely a need for prescription medication, but I do worry that it's overprescribed and peptides are underprescribed.
Yes, I couldn't agree more. I mean, we see this all the time where people There's also a disconnect because people, when they're filling out my intake, our intake here, and we're going over their medications, most people don't even know why they're on them.
Really?
So they can list, yeah, they will list 8 to 12
Oh my
medications.
God.
And I can say, well, when did you start taking that? And why was it prescribed to you? And they often don't know. So that is all a very scary aspect, I think, of medicine. There's been so much trust. And I want to say, I love medicine. Please don't
I
misunderstand me. I
agree.
love medicine.
Yep.
I love the function of antibiotics and all the things that we have access to. And we're so blessed that we do. But at the same time, there's not enough education behind them. So people don't realize they don't need to be on this medication anymore. And yet they're still taking it, for example. Or they don't understand that they have high blood pressure, whether they're on the medication or not. It's just that it's not symptomatic at that time because of the medication, but it's still something that they have to manage if that medication was removed. There's a huge disconnect and lack of education when it comes to the way our current medical system is set up. Again, thrilled that I think it absolutely has to change or it's going to, I think personally, explode. So
Mhm.
peptides are, I believe, one of the things that's going to make this happen because it is addressing the root cause of the issue. Let's say metabolic health, right? There's many different peptides for metabolism.
Mhm.
So if we address that, how much better off are people going to be in maintaining their weight? Or their the amount of energy they have, or reducing their 2 o'clock crash and not fueling themselves with a bunch of caffeine at that time, or sugar, or whatever that's leading to the cyclical cycle, right? So peptides are a way to break the cycle without having to be on a lifelong medication.
Yeah, that, but there's the Wolverine peptide, the BPC 157,
Oh
which I've
yes.
done with helping the gut healing. I think we could be on this podcast for probably 3 hours to go through all the available benefits of peptide therapy. But just it's getting people. I also think, Stephanie, is getting them out of the mindset that a prescription drug is always the answer. But unfortunately,
Right.
medicine, that tends to be the de facto course of action when somebody goes to the doctors. Oh, you got high blood pressure, you got to do this. And so I do think that sometimes people do not understand that there are things available that they can do.
Right. Yes. That's true. And that's where that empowerment piece comes from. That's the aspect of coaching and wellness that I love so much because it's empowering the patient to do a little research, dive deeper, ask themselves some of these very pointed questions that might be hard to ask, figuring out what is going on with them because A, everyone is different, and two, they know better than anyone how they feel. And they're only giving a 15-minute snippet of that when they're at the doctor's office, but they're living it every day.
Right, right. No, it's really it is really really important to really think about. It's kind of as I'm sitting here, a little overwhelmed thinking about how many different peptides there are. And I know we don't have time to go into all of them. I do want to go into a couple though, but
Okay.
the benefits of them and how we change the perception of them is going to get people to take the necessary action and not be afraid of it. So I guess it comes down to one word: education. Being able to
Hmm.
educate your clients or the listener of this podcast or people that you communicate with that, hey, have you ever tried peptide therapy? Have you ever looked and thought of going that route? I would tell you, if you polled 100 people, you might find 3 people that have done it.
Right. Yes. I
They may
agree. They
know
may have
about
heard of it, but
they know about
yes, that's what I was just
they
going to
probably
say.
yeah, they probably have not done it. Agreed?
Right.
Yeah.
Agreed. Yes.
So
Yeah.
there's
They've
a lot
thought
of
about it, maybe,
yeah. Well,
but
it
haven't
goes to show
bitten
you
bullet.
how much upside there is to this. If people would kind of just open their mind a little bit and really really understand that maybe there is a better way.
Yes. Yes. Yeah, and that is a big goal of mine, is to get more education around peptides out there into social media, and other venues that we're able to speak to, and just workshops and things like that in clinic, because it is something that people need to know about for sure, and have a little bit more confidence, because there's a lot of scary stuff out there on the internet, and there's a lot of talk about research peptides and buying stuff on the black market, which we kind of talked about, we touched on in one of the podcasts. And because it is such a buzz right now, there are so many different companies out there, and some of them are scary. And knowing the difference between what is safe to take and having the education behind it and having the testing, and a lot of these companies don't have testing that's available to the public, but there are many that do. And so knowing where to find them and who to go to for that education and guidance is incredibly important. And also build your confidence and empower you to maybe want to try one of them, and have somebody help you understand what it may or may not be doing for you, or if it's the appropriate peptide for you.
Yeah, no, that's a
I
good
think,
when you talk
yeah.
about research, can you kind of explain like what that looks like? Like on Facebook, I see the ads all the time. Most people probably just scroll by because they don't really. A lot of people, for some reason, they're just it's they have trouble getting out of their comfort zone. But there are people that, for cost reasons, will go that route and not really understand what they're doing. So, could you explain to the listeners what the difference is as opposed to like what you offer at Be Vital Wellness?
Okay, yes, I'd be happy to speak to that. The research peptides are, they're not recommended in my setting, a clinical or wellness space, but online they're all over the internet, and they are not regulated, they're not FDA approved for human use. And so, but it can be sold to humans as long as it is labeled that way, and there's no medical or safety oversight, unfortunately, for those companies. I'm not saying that that means that they're dangerous. Not all of them are, but there's no way to really know. So it's a little bit of a risk and can be very scary for the consumer.
Yeah, it
But go
is.
ahead.
It'll say right on the ad for research purposes. So that should be a red flag
Yes.
for people if they're trying to investigate peptide therapy on their own. That should be a red flag.
Yes, absolutely, because that eliminates any legal or liability risk for that company. So think about that. There isn't the accountability, there's no sterility assurance or quality and purity guarantees. And I always worry about folks taking something in that may have metals in them or arsenic and things like that. And I know that sounds dramatic and extreme, but that is, if it's not regulated and it's not FDA regulated, it can have those things in them. So you want to make sure that you're working with a company, or you're getting your peptides from a clinical grade peptide company that has certificates of analysis. I cannot stress that enough.
Mhm.
So that's a very important thing to protect the patient and their safety.
So I want to circle back to something you said at the beginning of the podcast. You were talking about peptide therapy being around for a really, really long. So what I was saying was back in the day, when peptide therapies first came out, because very few people knew about it, I have to assume, for the lack of a better phrase, was it really only for the rich and famous? Is that a good way to describe it? Or
I think so. I think so. I think it was definitely used in medi spas that were upscale, that are upscale, and in certain pockets of the U.S. It just wasn't part of the mainstream health and wellness scene. It was more, I believe, kind of the elite, if you would.
oh, interesting. And okay, that's kind of thought so because I was kind of surprised at how long you mentioned that they had been around. I probably discovered peptides probably I don't know 9 years, 9, 10 years ago, but it was like something you just didn't have access to. So that's I guess that's why I was asking about that.
Right. Yes. And I had a patient recently, a 74-year-old man who it was recently, I say recently sober, but I want to say 20, 25 years sober. And he dove really hard right before stepping away from alcohol and drugs. He dove into anti-aging therapies, and that is really what got him away from using substances that were hurting his body. And so he said that he's been using peptides for over 30 years. And I wish I'd asked him more about that. He was living in California when he discovered peptide therapy, and he's been using peptides and hormones for a really long time. And he is incredible. This man's cognition, I mean, his mental capacity it blows my mind. And, to know what he's been through and how he's managing his care now is just, I definitely think it's something to aspire to. He's quite a model.
Well, you said cognition. That's all of a sudden people listening to this are gonna be like, oh my gosh, you've got to be kidding me. Because a lot of people feel like as they age, they walk into a room and they can't remember what they walked in for.
Right.
That alone would be an incentive for people to investigate peptide therapy even more. So let's just talk quickly about like what are some of the more popular peptide therapies and what can they accomplish for people?
Okay, so I do want to go back to one of the ones that you had mentioned, BBC 157 and Wolverine, which is a synergistic stack of two peptides, BPC 157 and TB 500, and those are used in different aspects of health. One of the ways that it's seen in our patients is through pain management and healing. So my business partner is a chiropractor, and she deals a lot with pain management and knee decompression. So we have a knee restoration program, and stacking these peptides on top of some really wonderful therapies and modalities, it brings you to the next level. It really expedites their healing. It reduces their systemic inflammation. So if you have someone who has if you have a chronic injury or chronic inflammation, it is unbelievable how much it can reduce that for you, which in turn will help you continue to move and work out and go for walks and all the other things that you want to do to help that injury or that chronic knee pain, rather than the opposite, where if you weren't doing anything about it, you would be more afraid of going for that walk, let's say, or going skiing and that kind of thing. So that's one of our favorite peptides.
Is that also good for gut health?
Yes, actually, BPC 157 is a peptide that's made in our gut. So if you are lacking that and you're having something like leaky gut going on, it is very therapeutic to do BPC 157. And I really love the combination of BPC 157 and KPV for things like colitis and leaky gut and IBS.
Wow. Okay. I have not heard of KPV, but I wrote that down. All right. What are some of the others?
Copper peptide, which I believe I mentioned earlier in our talk, copper peptide is wonderful for the skin. It also is anti-inflammatory, but skin, hair, and nails, copper peptide kills it.
Oh, wow. Okay.
Yeah, it is. It's hands down an amazing therapy for beauty, but also is great for autoimmune as well.
Oh, amazing. Okay.
Yeah, so very much
Threw that.
associated with anti-aging.
Yeah, kind of threw that one in at the end there, Stephanie. Okay, a couple more and then we'll wrap it up.
Okay. Let's see. So there's two mitochondrial or metabolic peptides that I really enjoy. One is MOTS-c. I don't know if that's one that you've heard of before, Marcia, but
Yeah.
it is fabulous. It is a mitochondrial peptide. So I know that has been a little bit more on a buzzword, I would say, and social media as well, having dysfunctional mitochondria. And for those who don't know, mitochondria are the organelles that every cell has, and that is what helps produce energy. So if that's not working efficiently, you're not going to have enough energy in your body. You're not making those molecules like you should. And that can also contribute to fatigue and foggy thinking and increase your aging, expedite your aging. So it's really important that we take care of our mitochondria. MOTS-c is a short protocol, 20-day protocol, but it is phenomenal. I like to think of it like recharging the battery, recharging those mitochondria so they can work for you instead of against you.
Amazing. Amazing. I think that's probably the chief complaint that you get from people is I just at 5 o'clock, I just have no energy for anything. So, wow.
Right.
Okay.
Especially
What
in the
else have
winter,
you
you
got
just
in your
want to
bag?
go.
I'm feeling like, oh my gosh, I can use all of this.
Yeah. And that's the problem. That's where the overwhelm can come from because there are so many amazing peptides out there. Where how do you know where to start, for your health? So that usually requires some questionnaires and some guidance because otherwise it would be too overwhelming.
Yeah, you wouldn't even know where to begin. So that
That's right.
the in-depth consult comes in, and you can really guide them and get them on the right track, and make sure that they're selecting the right peptides for what they need.
Right.
Are there any others that you can think of that you want to give a shout out to while we're?
And yeah, I mean, I do love the secretagogues. They are, people often misunderstand that they are growth hormone. They're not. They are just something that helps the body in the creation of growth hormone. So that is things like CJC and Impermorelin and Sermorelin, and those are wonderful to use for people who are working on their fitness and or their cognition. And then there's one last one that I would love to speak to, which is AOD 9604. It's a peptide that is derived from growth hormone and is commonly seen in clinics and wellness spaces, but it's for fat metabolism and body composition support. It was actually named AOD is anti-obesity drug. It was named in Australia. I forgive me, I don't know what year that was, but we do use that for folks who are struggling a bit with their weight loss. If they're using a food plan and they're just not able to really get going, sometimes this can take them over the hump and
Oh,
get that moving.
interesting.
Yeah.
Wow. Wow, that was quite an education. I Yeah, I just am amazed at the amount of information you were able to provide on this podcast for people who have questions. And I think it really does boil down to the education piece, and what better educator than Stephanie Nascimento of Vital Wellness, who is so fluent on all of this and can guide you in a number of avenues towards wellness, whether it's weight loss, cognition, lack of energy, gut health. I mean, the list goes on and on. So I highly encourage you to book a consultation with Stephanie and get your life back. Have you ever had a day where you've gone through the day and at the end of the day, you just did not get done what you wanted to? And our time is our biggest commodity we have, and we can always make more money. We can never make more time. So it's important to kind of seize the day, and nothing in this world tastes better than good health. Agreed?
Agreed. I love that.
All right, Stephanie, thank you so much. So, why don't you let the listener knows how they can reach you? Okay.
Sure, absolutely. So if you are curious and want to chat with us for a bit, all you have to do is look us up online, bevitalwellness.com. You can also give us a call at 413-387-0219, or you can email us at hadley@bevitalwellness.com. We'd
And
be
Stephanie, you
happy.
are as beautiful as you are knowledgeable. And I know everybody that walks through that door is going to be so happy they have met you,
Oh,
including myself. All right, everybody. Thanks
thank you,
for
Marcia.
tuning in. You've been listening to Stephanie Nasmento of Be Vital Wellness of Hadley, Massachusetts, talking about peptide therapy. Tune in again. We're going to be back with another show with everything related to wellness. Make it a good week.
Thank you. Have a good week.